Good afternoon. I'm Patty Hart. I'm the Chief Nursing Officer here at MUSC in Charleston. And I'm here today with Shamika.
Hi everyone, my name is Shamika. I am a pediatric registered nurse here at MUSC, and I've had the pleasure of being employed here since I've been 19 years old.
Wow.
I know. I actually did a little bit of PCT work and unit secretary work, and the last almost 6 years as a pediatric registered nurse, all at MUSC Children's Hospital.
And in the float pool.
Yes.
And Shamika just graduated with her nurse practitioner as well. So we're so proud of her. And she was our first person to be immunized here with a COVID vaccination.
Yes, I definitely was, and I have to tell you, I've been very honored and privileged to be the first. It was a whirlwind experience on that day, and I actually had my second dose. I'm fully vaccinated, and so I can say, go get vaccinated, everyone.
So why did you decide you wanted to get vaccinated?
So I went. It definitely was one of my personal beliefs that I should be vaccinated. One, because 2020 has been such a trying year for so many people. So many people have lost their lives, lost their jobs, been unemployed, and have been really sick because of COVID. And as a healthcare professional, I've seen how this could affect not just the patients but their families. And I wanted to be a part of a new beginning. So that was one of the main reasons on why I needed to be vaccinated. How about you?
Well, I think it's our responsibility as healthcare professionals to really take advantage of that cutting edge research, right? And I think it's so important to not only care for yourself and care for your family and also for the community that we're serving. So I felt like if we don't do it, then how can we tell others that this is the right thing to do? So we felt it was very important. We've talked about it as a leadership team and agreed that that's what we have to do to set the standard.
And I absolutely agree. So, Patty, can you tell me why do you think nurses and other healthcare workers are hesitant to get vaccinated?
Yeah, I've heard a lot of different things. There have been several that have shared with me that they're concerned about the long-term effects. And some individuals have shared that they've had COVID, so they're waiting until closer to their immunity might not be as high just because they had the vaccine. I mean, then they'll get the vaccine. A lot of people have said they're going to wait and see what the next layers come out because there will be single dose. So I think that a lot of times it's just that wait and see is
Yes.
what I hear. How about you?
Yeah, I've heard the same thing, especially from some other coworkers as well, that even though they may have done their own research, that they would like to wait and see as well. I've had many people come and ask me about side effects and symptoms that I experienced getting my first and second dose, and they still had a little bit of question marks. They also had some questions about the newness of the vaccine, and that kind of made them doubt a little bit. But I think as frontline, healthcare professionals, like you said, we have to be the true example of trying to actually hone in on getting this COVID numbers down. And the only way we can do that is by getting vaccinated, right? So I keep telling everyone who comes to me and asks me, like, should I get vaccinated? Do your research, and and deal with your own personal beliefs about it, and then think about your family and your friends and your community, and make that decision for yourself.
Yeah, and there's a lot of stuff out there. You really have to figure out what are those right and most effective places to look for information, and that's what I want to also make sure that we guard people against, right? So
Yes.
a lot of comments, a lot of opinions, but really making sure that you go to the facts and making sure there's a lot of medical information out there, a lot that is published by the vaccine companies, and those are really reliable sources. CMS has a lot of good sites that have question and answers, and they'll be the places that you should look rather than just looking to other opinions that you might find posted or in different places, right?
Yes, I think that will definitely help cut down some of those rumors that people are hearing. So I think that you really pointed out on how we know this vaccine is safe.
Yeah.
So I know, like we just talked about, a lot of people like to wait and see. Do we have like any additional information about long-term effects?
Well, this we did get emergency clearance to get this vaccine through, so it was an emergency use, which does shorten the time that the studies are completed. And so the longitudinal part, or the long-term effects of the vaccine, aren't all there. But as we continue to get vaccinated, and we're continuing to keep records of the vaccinations and the side effects that take place, that's really where we're building our databases from. And right now, they're very minimal problems. Obviously, the effects of people having COVID are much worse than what the vaccine ever has provided. And you mentioned a little bit, Shamika, about the side effects that you had. What were they? What did you have from the vaccine?
So my first vaccine, which I don't think a lot of people know, I was actually working the day that I got the vaccine.
I remember. You were still in your scrubs.
Yes, I was. So I actually went back to work right after receiving the vaccine. And I worked the day after. So I really didn't have too many side effects within the first day or so, other than a really sore arm. It kind of reminded me of the flu shot a little bit. So that went away within a few days, and maybe a little fatigue. But so my first shot, just the sore arm and a little fatigue. The second shot, I kind of prepared for. I did hear some rumors about the second shot, just that you may have some more side effects. So I did take a little Tylenol beforehand, just to kind of make sure I kind of minimize those side effects. The sore arm was actually a little bit less with the second shot, but after that I did have a little bit of fatigue. So I did recommend to some coworkers to just maybe take a day or so off, just to kind of, sleep a little bit, let that vaccine work. And I actually appreciated having a little bit of body aches and soreness, because I'm like, this vaccine is actually doing what it's supposed to do,
That's
get
right.
those antibodies working.
That's right, because it's not a live virus, right? So
Right.
it is truly just stimulating your body to build
Right.
up some kind of immunity against it. And I had the same thing, just a little bit of soreness at the site, and my
Right.
second was much better than the first one as well. And then the second one, I was a little more fatigued on the second one than I was on the first one. And I agree with you that just allowing yourself the time to rest and take that time, get a good 12 hours of sleep, maybe instead of 8 or 8 instead of 4.
Exactly.
But I think that's the important part, is that you listen to your body and you respond, and by taking the Tylenol you might have avoided some of the other side effects. Some
Right.
people have a low-grade fever that they've complained of, or but the biggest were headache, and those are a couple of the other ones that other people have shared with me as well.
Yeah, I heard a little bit about muscle aches too, body aches, headaches, fevers, but those are all good body responses to the vaccine.
Right.
So Patty, what are MUSC Health vaccination rates at this time?
So as of today, we have 56.5% of our staff have received their immunization, and that's the entire Charleston campus, which includes those that probably are not quite eligible for that yet as well. And then we have about 46%, I believe, 43% have not had the vaccine at all, and 48% have received their second vaccination. So 48% of our staff are completely vaccinated at this point. And most of those are in the clinical areas.
Right.
Mm-hmm.
So I'm going to answer this question. Why do we still need to wear our masks and socially distance even though we have been vaccinated, right? So as you see, we still wear our masks. That's the MUSC policy, to wear your mask on campus. And inside the community, I feel like we should be doing the same as well. Even when I was vaccinated back in December, I still wore my mask and socially distanced 6 feet apart. Just because that vaccine takes about 21 days before you get your second dose for you to be fully vaccinated. So if you had a pre-exposure before that vaccine, or possibly was exposed during that 21 days after your first injection, you're still pretty susceptible of getting it. This might be a little bit lower risk, but you're not fully vaccinated yet. So it's still very important to wear your mask, do that socially distance, to staying 6 feet apart, and hand hygiene. And we say that for everything, even with flu or any other viruses out there, you're supposed to do good hand hygiene anyway. So I always, and I'm going to stress the importance of always wearing your mask and socially distance anyway.
Yeah. So important when you think about, I mean, all of the immunizations are coming in with efficacies or the effectiveness of over 90%. Some of them, I think it's about 95% for our Pfizer vaccine that we've been administering here. But that still gives you that 5%, that small window that it might not be effective for you. And so it's really important that we continue to wear our masks and social distance. And, you know, it kind of reminds you of going back to the basics things, right? You know, no matter what we see, whether we're talking about any infection or any kind of health care acquired conditions, the best thing to do to avoid the spread is to wash your hands. And when we think about, those are basic concepts, all the different things that we have, tools in our toolbox, right?
Right.
Washing our hands and wearing our mask and social distancing are going to be the most effective and the best things for us to do.
I absolutely agree. Even my 3 little kids wear their masks when we're out in public.
So important. So important. You're keeping them safe.
Exactly.
Right?
Exactly.
You know, and there's been a lot of conversation about that. That's been a big question that's been asked of us about the mask. And because we're immunizing so many people and we're getting the vaccines out there, and South Carolina has done a really good job at delivering the vaccines that we have. But it really is important that we continue to do best practice and all we can to keep us safe.
I think there's a question we skipped a little bit, but how do we know that this vaccine is safe?
Well, the literature out there, I mean, we've kind of shared with you, you have to be, you know, looking in the right places, but we do know that we've been administering the vaccine. Not only was it through the emergency preparedness, it went through an FDA process, and then in addition to that, we continue to keep that data, and so it's important that we are continuing to log all of the vaccines and trend it over time, right?
I definitely agree.
Yeah, and there's been a lot of conversation too around policies that say, should we or would we mandate people to get vaccinated? And we've had conversations about that with care team members about their anxiety, and there are still some that, as we're expanding on the vaccines, that we've decided at this time at MUSC we're not mandating at this day because there's still some anxieties about it, and we feel that it's better to do the education and to really get out ahead of it like we're doing here and continue to answer questions and look at how we can help support people and their anxieties around it and give them the information to make the best choices possible rather than through mandation at this time.
Okay. We had a great question. When will the vaccinations open to others, such as government employees? Right now, Patty, I believe we're still in phase A, where we're just offering to medical professionals at this time, anyone over the age of 65.
Yes, and we just expanded to caregivers of young children who have complex medical challenges. So we are requiring that they have a note from their doctor in order to do that. We're still recommending at high risk individuals are getting vaccinated as well to speak with their doctors about that. I know there's a lot of information out there. The educators, they're looking at where they fall in the vaccines, where government workers and the front lines are at, and those are next in 1B, I believe, are the next phase. But that has not yet opened, and as soon as they determine the level of where they're opening, then that's how we really decide how to immunize. And we've opened as soon as the recommendation comes out. MUSC has responded and immunized those individuals, and we enroll them through the scheduling system, and then they're prepared to come and get vaccinated.
And there are multiple locations where you can be vaccinated through MUSC. If you were to go to muschealth.org, where you can actually, if you're in that phase, you can actually go and sign up for your first vaccination and your second vaccination. It's very quick and simple and easy process. I've done that for my grandmother as well, who is over 65 and will have her first vaccination. She saw me and she was very encouraged and excited to go and get her vaccine. So that was a privilege for me.
That is. That is. So there was a question that came in about variants, and this is one of the things that we don't know as much about, but we do know that as we gather more information, the variants does spread a little faster, and that's another reason why you wear your mask, social distance, and continue to get immunized. These are things that we will continue to monitor, but as variances, which are just mutations in the virus, that's what they are, and they respond. They make your body respond in a different way to the COVID virus. But at this time, that's something that we are monitoring and determining what variances are covered by the vaccines.
That kind of reminds me a little bit about the flu. I know a lot of people have been asking me too, what does it mean by variants per se? And I kind of think about the flu and how we have like different types of flu A, flu B, and you can have possibly the same thing with COVID. So it has to, we have to research and we have to get more information and let the scientists do all their research and see about tweaking the vaccine itself to make sure that everyone is covered. So if you think about that a little bit, it can kind of give you a little bit more clarity on what the variants actually mean.
Agreed. There was another question that came in about if will I test positive after receiving the vaccine? You will not test positive on the COVID test. So I believe that they're asking about the nasal swabbing test for COVID-19, and you will not come out as a positive for COVID. Now there have been people who have in that period of time, a couple days after they've received the vaccine, ended up testing positive, and that really was because they've had a positive COVID reaction or exposure. They had COVID and they did not have symptoms until after the vaccine was administered. So we have seen that, but that's really during that period of time that you were speaking of, where your body is really building up their immunity.
Right. Oh, have we heard of a COVID arm, a bad rash, swollen arm after a shot? So I think we spoke a little bit about this too. I know both Patty and I have experienced that really, really sore arm. I recommended to a couple of people to actually get the shot in your dominant arm because that is the arm that you work the most. So if you're left, you write with your left hand, get your shot in your left arm. If you're right-handed, get it in your right arm. Like I said, I went right back to work afterwards. So just using that muscle definitely helped with getting that soreness down. Did you heard of a rash at all?
Yeah. Yes. There are different strains that have or different vaccines that are a little more prevalent with the rash that comes at the injection site. But yes, there have been a number of people who have had a rash during right after their vaccine.